Our lecture is about health behavior. How many of you till now read the lecture? I have uploaded, I think, before 5 days. Okay. 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 So the content of our lecture is introduction to health behavior. What is behavior, especially healthy behavior, and how to change our habit. Then some model about the behavioral change, and the last one, cognitive behavior approach to health behavior, how we treat our behavior through the cognitive behavioral therapy. So now the first topic in this lecture is introduction to health behavior. As you mentioned in the previous lecture, that the pattern of the disease nowadays changed dramatically in the last century, from the infectious disease to developing so many chronic illnesses. And these chronic illnesses, sometimes some behavior have a great role in developing these disease. For example, smoking. It is a cause of so many medical illness. So smoking, it is a behavior, the bad one, and how to change this behavior. Obesity, sedentary lifestyle, and so many other behavior which have an impact in developing disease. So, as you know, smoking sometimes causes what? Lung cancer, cardiovascular diseases, and alcoholism. Sometimes cause what? Causes pancreatitis, infection of the pancreas, causing alcoholic liver disease, liver cirrhosis, liver failure. So, how manage this behavior to prevent illness and to increase lifespan? And it is not increasing the number of the year you live, also a year free of disease. So that's why now we need study health behavior because of developing chronic illnesses. And there are some examples, as we mentioned previously, regarding the behavior which cause chronic illnesses, and it is very important. You should know the correlation between these behavior and the disease, especially for the multiple choice question. For example, heart disease. If anyone can read for us, heart disease cause what? By what behavior you will get heart disease? هەندێک جارەمە شێرین بێ ئەوکەم بۆیە خەوتان لێ نەگەێت چکە ئۆنلاین ئەو شتەی تۆزە ناخۆشە کە شێرین نەکەی. Any idea about which behavior, which risk factor has a link to heart disease? کێشی ساوەندە مێجۆتان لێت؟
جمالة دكتور.
اذا باش
هيك
يلا شي كستاختيني خو بالنيون
الدكتور كان بمباني الزواج استاخذ محاضريني
اجا فوق اللي كان قصي شابين هذا صعد نوبو
اخر اول شيء سلام لنا وجيجا ومالي خواني يسراحات بوي
ولا سالكرسي دانيشن بيهي فرقة عم بقورن
انا ما خوبت انا دي
بلا سالكرسي دانيشن نقلنا وجيجا موبايلك يا لابتوب كيتو طبعا خبرنا ده متشاو نشتغل ها اوكي وش الحبيتو بيهي فرق اوكي سو بس يوادر موني بس جوين تان نكرد بيتو وقعتان لينا به
دكتور بس أحمد أما اشتك بولم زۆربەمان کارەبامان نییە لە شۆ بڕاوە خەتە کاپ پاوەڕەکی کەمی تیاماوە ینی هەر بۆ نازانم ینی هەر دەقێ بکوژێتەوە
دەست چیکین دەسەڵاتین باش زۆر چاکەی سامە هەوڵێن بە خێرایی چیکین وڵایمە ئیژاوە ناڕۆ زۆر باشە يلا من بخيراي إني كم أزام سكرينة كم ريكورد هنا تكنيكال إيشو رواية بما نتجاهل بس ريكورد ده سبيكر لو كاتا بيرم شو برحل شنو مثلا يوداري نتر So I'll repeat it because of recording. So as we said in the past century, most of the disease was infectious disease, and the most people die by the acute illnesses. And nowadays, due to the increase in the lifespan, there are developing so many chronic illnesses. And as I say, the behavior has a great role in developing these diseases. For example, smoking, drinking alcohol, sedentary lifestyle, obesity, and so many other bad behavior has a great role and impact in developing chronic illnesses. And we have these which is very important. You should know the link between these risk factors to the developing these chronic illness. For example, heart disease, smoking. If you have hypercholesterolemia, high cholesterol, hypertension, physical inactivity, that's to say sedentary lifestyle, obesity, diabetes, stress, all has a role in developing heart disease. The second one, cancer. Smoking also is a risk factor for developing lung cancer, especially. Unhealthy diet, environmental factors. Stroke. I think most of you know what the stroke. Cerebrovascular accident. It is we call it جلطة مشك. It is two type in the, I think the 11 lecture we'll talk about in detail. So high blood pressure, also smoking, diabetes, high cholesterol, also sedentary lifestyle and obesity has a role. Accidental injuries on road, failure to wear a seat belt. طبعا مش هالبيهيفير كتو قايشنا بس يشدنا بس يو باد بيهيفير هكر لكاتي accidentega طبعا you'll get unfortunately great damage if you not wear a seat belt. So in the home, sometime fall, any type of fall, poisoning, fire, so linked to accidental injury. Chronic lung disease in general, environmental factors, smoking, environmental factor like, if you work in a factory, in a place, a polluted place, so you may liable to get chronic lung disease like fibrosis, occupational lung disease, cancer, and it is a long list of chronic lung disease. So what are the promotion? How we promote our health? So it is a philosophy that a good health or wellness is what is a personal and collective achievement. This is not a personal. Sometimes personal, you personally try to promote your health behavior, or collectively as a community, you will try to change our behavior. So for any person, what does it mean, promotion? It involves developing a program of good health habit. You try to put a program for yourself. Which program fits you to promote your health? Well, for us as a medical practitioner, it is how to teach people to achieve a healthy lifestyle and help them to modify the risk factors so as not to get the chronic illnesses. And we monitor their illnesses and treat their illnesses. While for the health psychologist, it is what development and intervention. As we said in the previous lecture, through the study, through the investigation, through the large-scale program, via TV, via meeting, and so on. While for community and national policy makers, the promotion involve emphasizing good health and providing information and resources to help people changing poor health habit. زۆر جار بینیتان لە تەلەڤیزۆنەکانەوە یا حکومەت لە ڕێگەی هەندێک پرۆگرامەوە هەوڵە گۆڕانکاری لە هەبیتی خەڵکا بکە to promote a good health. هەروەک لە کاتی کۆڕۆنا بەردەوام ئاگاداری بڵاوکرایەوە کە چۆن هەڵسو کەوتکی بۆیەوە so as not to get COVID illnesses. ئێستا 21 هیچ 19 کەس لەسەر خدماوە ئەگەر کێشەتان بۆ دروست نەبوو بێ. Now, what are the benefits of successful modification of our health behavior? It has a role in reducing the number of deaths, and it will not reduce, just delay time of death, so increase life expectancy. And the most important one, if you practice a good health behavior, it is, as we said previously, it is not just expanding the number of years you live. Also, you enjoy your life free from the chronic illnesses and pain and morbidity. So, and the last one, to make a dent. What is the dent? The reduction, decrease in which is very important for the government, costs, in the cost and budget that spend yearly on health and illness. As you know, yearly, a lot of money has been spent in the healthcare system. So if you have a good health behavior, you prevent some illnesses, so you make a reduction in the cost and budget which is used for healthcare system. Now we have a health behavior and health habits. There are some difference between the behavior and habits. The definition of the behaviors is a behavior undertaken by people to enhance or maintain their health. It is not automatic. While the habit, it is the behavior that is firmly established. and often performed automatically without awareness. And most of these habits develop in childhood and begin to stabilize in which age? 11 or 12, according to this study by Cohen and Braunwell and Flex in 1990. So most of our habits develop in childhood, not adulthood, and established around the age of 11 or 12. Like what? Like brushing your teeth, eat a healthy diet, wearing a seatbelt. بۆ منە تۆ کە مناڵی سوار سیارە دایک و باوکت بەردەوام خان بەسنەوە تۆش ئۆتۆماتیکلی وات لێ خۆ دەبەسیتەوە بەبێ پێ بگوترێ یعنی ئەمە هەبیتە ئەمە بیهیڤەر نییە ترێ بێ بە خویەک تۆ هەبیت تقریبا نەکو خوایە. Okay, so this habit in the beginning may be reinforced by positive outcome. You try to get approval by your parents, or you will try to get a reward, but eventually become independent of that reinforcement. يعني تو كتلاقي شو تمني أجر خود أوتوماتيكلي دانا شو عم بيقوي كسبيدله establish بو أم هالبيتي establish بو دا بيست دان شو بيست كلكاتها بخير أمانة هبيتي كبيقوي كدايك واقف بيبلا تتعب بس develop بو لتواهي. So consequently, it is important to establish good behavior and to eliminate poor one early in life. Why? Because if early in life you eliminate this bad behavior, it has a great effect in the future. So, and according to this study in 1972, which has been done in California by Belloc and Breslow, practicing this habit lead to fewer illness, better well-being, and lower mortality rate. Even it has effect when we become older. Like what? Sleeping 7 to 8 hours a night, not smoking, eating breakfast daily, regular exercise, not eating between meal, maintaining a healthy weight. أما criteria يعني والقلتو بسطة دي كان وfollow بي personan كردوا follow of these people 9 to 12 years later found that mortality rate were dramatically lower for people practicing the 7th health habit. 7th health habit كباس ما كرت effect لسه شيء هي mortality. Anyone remember what's mortality? What's mortality?
The number of death.
Number of?
Death.
Death, yeah. Number of deaths. And morbidity?
The number of the people that get the disease.
Yeah, very good, very good. Thank you. So, and now we'll shift to another topic, primary prevention. In the previous lecture, we mentioned about the prevention. What is the prevention? It is not to get a disease. We take some action before the disease will occur. So, regarding the primary prevention, it is called we have no disease and try to prevent it, either pharmacologically or through changing behavior. But our topic is about changing behavior. While we have another topic, which is not in our lecture, is the secondary prevention. The difference is that in the secondary prevention. We have a disease and try to not get the disease again, or the disease not become worse and worse. So this is the secondary prevention. For example, a person has an attack, a stroke. You'll give him or her some medication to prevent another attack of stroke, or make him to leave some bad behavior so as not to get another attack of stroke. But primary prevention, we have no disease in the first place and try to not get it. Okay, so the first and most common strategies was to get people to alter their problematic health behavior, like losing weight through the intervention, so as not to get obese. And the second one is to keep people from developing poor health habit in the first place. Okay, so it is clear, prevention. So practicing and changing health behavior. Which factor and what factor lead one person to live a healthy life while another one compromise his or her health? So some people going according to the healthy behavior, while some going with a bad behavior. So there are many factors has a role in this matter. For example, demographic factor. Young people, for example, educated people with low level of stress and high level of social support, they are typically practice better health habits than people under high level of stress with fewer resources. So if you are educated, if you are younger, so you may follow a good health habit rather than if you are under a lot of stress. So age typically good in childhood, deteriorate in adolescent and young adulthood. متنازعنا منال هبيت كان زوج باشتر جيك وقلا adolescent ده زياتر سرقي هندي هبيتي خراب هندي behavior خراب توجبه and improve again in older people. So in extreme of age, the habit is better in childhood and in older, while in adolescent and in adulthood you may get some bad behavior. For example, smoking. Most of the people start to smoke at the age of above 15 or 20. Most of the people will drink after 20. So in the childhood age, we have a good habit. And when we become old. So value, another factor. Is this health habit has a value for you? For example, for a woman, if they do exercise and not obese, so it had a nice look, so it has value for them. So value is very important, and especially in some culture. For example, in some culture, obesity may be stigma. So try to not to get obese. So another factor, personal control. People who regard their health as under their personal control practice better health habit than people who regard their health as due to chance. So if you can control your habit So you will follow a healthier habit than it is not under of your control. Social influences. As you know, most of the time you'll get to smoke due to influence by your friend, family member. So social influence has a great role. Personal goal and value. Health habits are tied strictly to your personal goal. If a personal fitness is important goal, so more likely to exercise. But if it is not your goal, you'll leave it and you'll not follow this exercise, and which has no value for you. So perceived symptoms, how you feel some bad symptoms make you to follow a healthy habit. For example, if you wake up early in the morning with like a cough, nasty cough, so you try to quit smoking, so as not to have a cough in the early morning. Another factor, access to the healthcare system. So if you have no good access to the healthcare system, you will not follow a good behavior. For example, Pap smear. You know what the Pap smear? It is a test done for the female to detect some sexually transmitted diseases. So if there is no such facility, you'll not go to the hospital and do it. Mammogram, and if you in your city, in your town, there is no mammogram, how to do a mammogram to prevent or to diagnose early cancer, breast cancer, I mean. Or if there is no vaccine in your healthcare system, how to do it. So accessing to the healthcare system is important. And knowledge and intelligence. So if you have a cognition about and knowledge about the illnesses, so you'll stick to a good behavior. And sometimes you have a barrier to modify your behavior, especially during childhood and adolescent. So the problem is that when you will do a behavior in early your life, you are very healthy. Especially smoking. Smoking, its effect will appear after more than 30 years. So, and you are child, you are adolescent, and you say, why I am smoking and still I am healthy? You have no that awareness that in the future you will get this disease. So this is a barrier. Emotional factor. If you have under the stress, you are sad, so you will get some bad behavior, which is pleasurable for you. You know, most of the people get smoking and alcoholism under the stress, and some people become a drug addict due to the emotional problem. So emotional has a great role in this matter. Instability of the health behavior. Health habits are only modestly related to each other. So most of those habits we mentioned, it is not linked together. For example, a person may exercise some healthy behavior while do some bad behavior. It is not necessary people have all bad behavior and some people have all good behavior. So you may have some bad, you have some good. So, and I think the last one. So these factor has a role in a role on a person how to live or compromise his or her bad behavior. Now the second topic in our lecture. چەند کەس هینەیە دەستان بەرزکەن و چەند کەس لە خەت ماوە 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 هیچیان سادی دانابوو باش دەستان خۆش بێ باشە خراپ نییە. Can anyone tell us till now, do you have any problem with the lecture or any topic will not, isn't clear? Can raise your hand and speak. Anyone have a problem with our lecture?
أظن الدكتور كان
ئەوانی کە پرۆبلمیان هەیە با قسە دەمزانی چێ کوچێشەکەتان.
دکتۆر کێشەمان نییە لەگەڵ دەرسەکە بەڵام دەنگت هەر لە سەرەتای لێکچەرەکەەوە وەشوەشەیەکی لەگەڵایە.
باش والله لەم چی دەرجاری وایە ساوندی دەریشۆ خۆ زۆر بێدەنگە. ئێستا چۆنە؟
ئەستا باشە بینی.
باش چکە هەندێکتان دواسەنێکتان هینیان هەبوو هەر مەسلەی ساوندەکەی یا شتێکی کە دیفیکەڵتیتان هەیە لە ئەندرستاندی لێکچەرەکەیە چی هەیە قسە بکەن باشە؟ هیچ مشکلی هەیە؟
نا دکتۆر کێشەی ئەومان نییە بەڵام سەوتەکەەوە هەر و خڕەخڕای تایە دەسەڵاتم کێشەی مایکەکە بێن هەیە دەنگی دەرەوە.
والله احتیمالیشە خۆ هەر خۆشم یا مەگەر دەنگی بزانم ئەگەر دەنگی و هینەبێت ئێستاژەر هەیە؟
والله دكتور كان مەگەر سەریکی نوعەکە وکەیت
جان
هەڵام خڕەخڕێکی ناخۆشیە مەگەر سەریکی مایکە وکەیت بۆ چابێت کێشەی دەوروبەر
خۆیت ماکیتر بەکار نایە.
ئاینێ وەڵی محاضرەوە تۆزە خڕەخڕێکی لێت
بۆ قسە ناکەن شتێک مشکلی پرۆبلێمی قسەکەن باشترە. تەسەوڕەکەن هی ڕیکۆردەکە بێ ئەوەی کە ڕیکۆردیەکەین لە سیستمەکەیە ئەو ئۆبیە سیستمە تەسەوڕەکەنی ئەوە بێت. ئێستا هەیە هەر دەنگەکە؟
بەڵێ هێشتا خڕەخڕیە.
زانم بەگەر لێرەوە لای بەمجانم ئێستا هەر ماوە؟
بەڵێ وەڵی دکتۆر ئەگەریم بوو بە مۆبایلەکە ئەگەر جوێنی کردووە بە مۆبایلەکە قسەکەیت بە لاپتۆپەکە خۆ میت کە مۆبایلەکە قسەکەیت.
والله مەگەر وای لێکینە بۆ جوێنم کردو بێ بڵێن شتێ بێ چاوم لێتان بێ بە جوێنەکە لابد لەوانەیە کێشەکەی ئەو بێت مۆبایلەکە ئێستاژەر هەیە؟
ئارە وەڵام زانەوە تاقیکەیتەوە مۆبایل جوێنکەیت
ڕیکۆردەکەت زەحاجز دۆزێ. باش
دکتۆر من ڕیکۆردیەکەم ئێستا محاضرەکە ڕیکۆردە ئەگەر کێشە ڕیکۆرد
زۆر باشە حەزەکی بۆ بزانم ڕیکۆردەکەت لا ئەبەمەوەی لای خۆم مادام تۆ ڕیکۆردە بزان ئەمێنێ لەوانەیە ئەو سیستمە بێت کە ڕیکۆرد دەکرێت.
دکتۆریان قسەکە
ئێستا هەیە؟
ئارە وەڵا
هەر دەنگەکە ماوە هەنا
تۆزە باشتر بوو ئێستا.
تصورەکەم باشتر لەوە چی ئەو هینە بێت
ئەخوا مایکەکەتە ڕیکۆردەکە نەبوو مایکەکەتە وایە گەرین بوو بە دکتۆرگیان بە مۆبایلەکە و قسەکەی بە کێشێمان
لێرە ڕاهێنێکی
دکتۆر گەنجا دەنگایەتەوە
آخر هەردووشی بێ دەنگایەتەوە ئێستا خۆ مایکەکەشم لا بردووە
دکتۆرگیانی دەنگایەتەوە ئیسعاجە
ئێستا هەیە
دکتۆر گەنجتار مایکەکە تاو نییە
وڵی خۆ لێکچەری پێشوشت بە هەمان لاپتۆپ و سەیرە نازانم هیچ گۆڕانکاریەکی ڕووی نەیەوە
ئەگەر گوێ لە خۆڵە تۆزە سەوتەکەی ئیسعاجە
چی بکەین وڵی نازانم خۆی ئۆنلاینە من هەر لە پێرس بێسەوە هیچ حەزم لێ نەبوو بس نازم لا
دکتۆر ئەگەر سکرینەکەش لابێ کێشەمان نابێ بە PDF لابمانە ئەتوانین بیکەینەوە مەگەم بس ئەو کاتە بەس مۆبایلەکەت ئیش بکە خۆتە قسە بکەی بەبێ کامێراکی خۆ لەوانەیە باش بەشوزانم
وڵای تر مەگەر ئەوەشیان یا لێرەوە لای بەرم بەس لە مۆبایلەکەەوە بێ باش لێرەوە لای بەم و بزاف ئەو کاتە سکرینەکە هین ڕاستەکەی بە PDF لاتانە تۆزە ناخۆش ئەوە بەس بەحاڵ زۆر باشە مەگەر وای لێ بکەم ئێستا لێرەوە لایە بەم لە مۆبایلەکەەوە قساکەم لەمایان
ئایبینێ دکتۆر
لیبەکەم بزانم دانگەکە چۆنە ئێستا لێرە
ئێستا
ئایبینێ زۆر بێکێشە
دیارە نەزەمە بێ لاپتۆپەی کێشێکی بۆ دروست بوو بێجینا هەفتەی پێشوو کێشتان نەبوو لە ساوندوشتە
کێشە نێ و بەس زانە دوای سێریکی مایکەکەیتەوە
بزانین زۆر باشە وتە ڕیکۆردت کردو تۆ دوایی ئەگەرین بۆ عەزت نەبێ بۆم بنێرە
بەستەرچە
من کەتی تێکە و بۆیە ئەپلۆدی چکە بێ ئەپلۆدیکەین لە هینەکەیە لە سیستمەکەیە
بەستەرچە
چاو خۆش بێ لەکوێ بووین باشە وەکو لێکچەر تاسە کێشەتانی وەکو لێکچەرەکە دیفیکەڵتی لە لێکچەرەکانە هەر ساوندەکە بوو دەستان خۆش بێ زۆر باشە بەس تۆ کە شتێکی وا بێت لە ئەوڵەوە قسە بکەن باشە با بژێن Now we will continue the second topic in this lecture about how to change our habits. So we have a quotation by this writer, Mark Twain. Habit is a habit, and not to be flung out of the window by any man, but coaxed downstairs a step at a time. So مەبەستی چییە؟ مەبەست ئەوەیە تۆ خۆ شتێکی ئاسان نییە یەکسەر لە پەنجەرەیەک و فڕیتە دەرەوە و تەواو بڵێ وەڵا ترم نەفەی بیتەم ناوێ بەڵکو بە هێواش تۆ زۆر جار لەوانەیە لە وەکو چۆن لە قادرمەیەکی هێواژێتە خوارەوە ئەو هەبیتە واز لێبێنی یعنی ئەوە ئاسان نییە کە هەبیتێک ئستابلش بوو تۆ بە ئاسانی هەمووتان نەزانن کەسەوەی کە جگەرەکێشە بە ئاسانی واز لە جگەرەکێشە نایە. So how we change our behavior. So first one, attitude change and health behavior. How our attitude has a role in changing our behavior and getting a healthy behavior. So regarding the attitude, there are three ways. First, educational appeal through education of people, through fear make people to fear from some behavior, and sometimes through messaging. Now, regarding the educational appeal, what does this mean? This is through good information about their habits. And when you communicate with the people to deliver information about the healthy behavior, this communication should be very clear and away from the difficult word, jargon. Jargon word means complex word. بونمنا من دكتورم يا اسمناو خلقه شوينك كدكتور نين قسا كم نابد دانشم كلماتي زور قرسي طبي بكار بينم ابي بوز مانك خصبكم كخلقه قال ينتيكا so jargon ما بس ديويا يعني medical term بكار بيني لناو publica. So the communicator should be expert, trustworthy. أمانة هم يقرن أبو multiple choice و true false. يعني character كان educational appeal أبي شون بيت بمشي وياه. Should be expert. إيش يجي سهي سنزانب إيش خواليات ولا social media سيركي هيج شتيشي واينية لبوارك expect نية سيركي بۆ بەسە دکتۆر وەکو دکتۆر قساکە وەکو نازانم سایکۆلۆجیست قساکە وەکو ڕایۆژکاری دەرونی بینیوتانە هەموو کەس بۆ بە قسە کرد کەواتە ئەبێ ئەو کەسە چی بێ ئەکسپێرت بێ prestigious trustworthy کەسێک بێ باوەڕ پێکراو بێ so and the message should be what? Short, clear and direct. Not go into a long detail because the people nowadays cannot get a message which is very detailed and very long. So short, clear, and direct. Very extreme messages are discounted. For example, a message that urges people to exercise for half an hour a day will become more effective than the one that recommends 3 hours a day. So you should tell the people to do a behavior which is applicable. It is not so difficult when the people cannot do it. So intervention must be sensitive to the culture. So you should go according to our culture. You should not mention something which is not suitable for our lecture, our cultures. So this is about the educational appeal. So through the education, and another one through fear. This approach assumes that if people are afraid from a particular habit, so they try to get rid of this habit. So but sometimes fear alone may not be sufficient to change behavior. Sometimes specific action is recommended so as to people get these behaviors. بۆ نمونە لەو کاتانەی کە ئێمە کاتی کۆڕۆنا بوو لە ڕێی ترسەوە هەندێک جار ئەمان و ئەگەر ڤاکسین وەرنەگری تۆ تووشی کۆڕۆنابی لەوانەیە گیان لە دەست بێ ئەمە فێر ئەپێڵە باشە یعنی تۆ لە ڕێی هەندێک جار ترسەوە کە پێڵێ ئەم بیهیڤەرە ئەگەر تۆ بەردەوام بی تووشی فڵانە نەخۆشیێبی لەبەرەوە لە تاو ترسەکەی خۆی واز لەو بیهیڤەرانەیە. But as you mentioned, fear alone may not be sufficient to change behavior. Specific actions sometimes are recommended. And the last one, message framing. through the message زۆر جار text message هەڵتیتان بۆ هاتووە یا لە بانەرێک لە شوێنێکە بڵاوەکرێتەوە باشە. Regard a health message can be phrased sometime in a positive or negative direction. For example, remind you about to get a flu immunization, can stress the benefit of being immunized or stress the discomfort of the flu illness. نەگەتیڤەکە چۆنە؟ ئێماڵێن ئەگەر ئیمونایزیشن نەکرد تووشی نەخۆشیەکە بی لەوانەیە بمری، ئەمە نەگەتیڤە. بەڵام پۆزیتیڤانەکە چۆنە؟ مەسجەکە ئەگەینی بە شێوەیەکی تر، ئەڵێن ئەگەر ڤاکسین وەرگری تۆ تەندروستە بی، بە ئیسراحەتی تو ئەڕۆی، بێ ئازارە بی، ئەتوانی بە دڵی خۆت وەرزشکەی ئەمە بکەی ئەمە بکەی. کەواتە through you can deliver your message in a positive or negative direction. So while a message that stress benefits are more persuasive for behavior with a certain outcome. So if you mention about the positive one, the message may be more persuasive and the people get this behavior and going through this healthy behavior. While if you're talking about the negative one, some people may not get it. And this is also different. Some people may get the message more effectively through a negative direction, while the other one through the positive one. So what kind of message framing will be most effective behavior also depend, as we say, personal personal characteristic. So if a person has a promotion or approach orientation, so they are more influenced by the positive message. While if the people have the avoidant avoidant orientation ئەوانە کە دایما ئەترسن لە شت دوورەکەونەوە حەزەکەن پریڤێنتی شتکەن ئەوانە بە نەگەتیڤ مەسج زیاتر پێرسوەی دەبن و شتەکە زیاتر وەرەگرن. بۆ نمونە ئێستامان ئەمە نەگەتیڤۆنە low calcium you say the low calcium will get you fracture. It is a negative message. While if you say low calcium intake will increase the bone, will make you stronger, this is the positive one. If you have a good calcium, you will get a strong bone and you can exercise effectively. While if you have a low calcium, will get a bone loss and you will get a fracture. So this is the difference. So if a person have a avoidant orientation or preventive orientation, so they will get a negative message more effectively than the one who have a promotion. While if a person have a promotion or approach orientation, so they will get the positive one more effectively. Now, the health belief model. We have a model by Hogbaum and Rosenthal about our health. This theory about how to change our belief about bad behavior. So it depends on two factors: whether the person perceive a personal health threat and whether the person believes that a particular health practice will be effective in reducing that threat. So this is the example regarding this model. We apply this model for stopping smoking. So in the first place, belief in health threats. We should believe that smoking is a threat on our health. For example, general health value. You tell yourself that I am concerned about my health. So the second one, specific belief about vulnerability. You will say, as I smoke, I could get a lung cancer. So now, belief about severity. If I get cancer, I may die. So now this second action you'll do. So believe that the specific health behavior can reduce the threat. So you do some behavior to reduce this threat. So in the first place, you should believe that this behavior is a threat on your health. And the second would you do some action to get rid of this behavior. For example, believe that the specific measure can be effective against specific threat. And you'll say, if I stop smoking now, I will not develop lung cancer. So believe that the benefit of health measure exceed costs. Example, you say, even though it will be hard to stop smoking, you say to yourself, it is hard to stop smoking, but it is worth to avoid it so as not to get lung cancer. So the benefit outweigh the pleasure of continuing smoking. So the third one, you do action. You say to yourself, I will stop smoking. So this is the health belief model. This is a model developed by a healthcare system in America. And we have another theory about the changing behavior. Theory أنا gringa قدربن content theory كشيء للانكيو بو تشيبوا أما theory كمتمان تشيبو the health belief model. And the second theory, the theory of planned behavior. Nice theory, okay, theory of planned behavior. A theory that attempts to link health belief directly to the behavior. So they link health belief to behavior directly, not indirectly, directly. So according to this, so according to this theory, a health behavior is the direct result of a behavioral intention. Behavioral intentions are themselves made up of three components. So it is said that health behavior is a result of our intention, our behavioral intention. And the intention has three components. First, attitude, our attitude toward the specific action, and subjective norm, personal norm regarding the action, and perceived behavioral control, how to control our behavior. So the theory of planned behavior applied to adopting a healthy diet. Now we will apply this behavior for what? For the theory for a healthy diet. So first, as we say, attitude toward a specific action. Belief. Our belief about the outcome of the behavior. You'll say, if I change my diet, I will lose weight, improve my health, and be more attractive. Good looking here. So our attitude about the action, what is our attitude? Here you say, if I change my diet, I will not become obese, so I will be more attractive. So evaluation of the outcome of the behavior, being healthy and looking good are desirable. And you'll come to the conclusion that if you are being healthy and looking good, so you are desirable by people. Second one, subjective norm regarding active. Belief of all people, belief of your surrounding. Norm يعني culture يعني بيرو باور كان أو شتباوة كان باشا. So normative belief. Example, you say my family and friends think I should change my diet. يعني تولى خود تبرسي علي دورو بركم حاور كانم أنا من دايتي خم بقارم. So you have a motivation to do that. So you say, I want to do what they want me to do. So they affect you, they have influence on you to change your behavior. So, and the third one, as we say, perceived behavioral control, self-efficacy belief. You will say, I will be able to change my diet, so you can to do it. And the fourth one, now come to our intention. You will decide to act. You say that I intend to change my diet. کەواتە گەیشتەوە قەناعەتی کە تۆ ئەتەوێت پێویستت پێێتی لە ئاخیرە شتە چیەکەی ئاکشنەکەکەی I adopt a healthier diet. ئەمە theory دووەم بوو نمونەیەک لەسەر planet behavior. کەواتە یەکەم جار ئەتیتیودەکەت دوایی subjective norm and perceived behavioral control کە ئەمانەش بوو you have intention to change behavior and you will act to change behavior. Now, as you said previously, changing health habit through something. First, attitude change and health behavior. Now the second one through لای خۆتان ئەگەر هینەکە بکەنەوە باشترە هەمووتان لای خۆتان نازم پاورپۆینتەکەتان لایە لە بەردەمتانە بێ باشترە زۆر چاکە. So now the second one through self-regulation and health behavior. What does it refer? Refer to the fact that people control their own action, emotion, and thought. So, self-control, self-regulation. You can control your action and emotion and your thought. A lot of self-regulation is automatic. You'll do some self-regulation without you aware about that action or that thought. But while sometimes some self-regulation is awareable, you are conscious about that. So, and try to meet your personal goal and try to control our thought, our emotion, to change our behavior. So we have a theory about that, self-determination theory. This theory guides a healthy behavior modification built on which idea? That the people are actually motivated to pursue their goal. يعني إما عادة motivation معناها ك چی بین دوای گۆڵەکانمان کەوین هەموو کەس کە گۆڵێکی هەبێ عادەتەن مۆتیڤی هەبێ بۆ نمونە تۆ ئەتێبی بە یاریزانێکی باش ئەگەر قەڵەو بی ناتوانێت بی بە یاریزانێکی باش لەبەرەوە مۆتیڤێکە دەیەکە قەڵەو نەبی. So, and the theory target two important components, autonomous motivation and perceived competence. So, أگر بۆتان هاتووە لە true false, the two important components of the self-determination theory is what? Which is a fundamental to change behavior, is autonomous motivation, automatically you motivated, or perceived competence. پاشا کەفاءەیتۆ تواناییتۆ لێهاتوویتۆ ئەوەی کە خۆت دەتوانی sense to control your competence. People are autonomously motivated when you experience free will and choice when making decision. کەواتە کاتێک کە تۆ free will ئەکت هەبێ خۆت فری بی automatically موتیف دەبێت کە تۆ گۆڕانکاری بکەیت و بڕیار بێ. So while the competence refers to the belief that the one is capable of making the health behavior change. So competence aware, you have a belief that you can do it. You can do this change regarding your behavior. So, for example, if a woman changes her diet because her physician tells her to, she may not experience a sense of autonomy. So, تو بەردەوامی کێشتێکت پێ بڵێ لەوانەیە سەیرەکەی ئەمە تۆ ئۆتۆنۆمی خۆت نەماوە تۆ لەبەر خەڵک ئەو شتاکەی. But when you have a motive, you have a free will, and you believe that you must change your diet for yourself, so you'll do it automatically. So in self-determination theory, the autonomous motivation and first competence is very important, and it's a fundamental for the theory. So if you have no free will, so you are not automatically motivated. Now, the third topic of this lecture is a important theory, which is called trans-theoretical model of behavioral change. This theory also for changing our behavior, and tell us that the change in health habit and behavior does not take place at all at once. It is not occur in one action. It needs so many stages to get rid of a behavior. So this theory by this scientist Prochaska and his colleagues in 1994, and this theory about what? Analyze the stage and process people go through in bringing about a change in behavior, and suggest a treatment goal and intervention for each stage. So stage أنا زور جرينجن باش بيكن ليتان تيجنا تشتكلي نكن و stage كان it is a chronological in step by step. The first stage is my first stage pre-contemplation. ناتوانیم بڵێ ئینومرێتیەکەی ئەبێ لە first stage و ئینومرێتیەکەی نەک first stage بیکەی بە contemplation. So now the first stage of this trans-theoretical model is what? Pre-contemplation. So in this stage you have no intention to change your behavior. نەگەیشتوویتە ئەو باوەڕێی کە تۆ بیهێڤەرەکە و بگۆڕی جارێ هەر لەسەر هەواسەکەی خۆتی تۆ پێدوانیە کە سمۆکین درینکین obesity it has a threat on your health. کەواتە لە pre-contemplation چییە؟ you have no intention, you have no aware about your problem. کەواتە چی importantە؟ not aware you have a problem. ئەڵێ جام من کەی موشکیلەمێ هەتا جگەرەژێکیش بۆ خۆم بە خێرایی ڕائەکەم و ڕاضەش ئەەکەم و هیچ مشکلەیەکیشم نییە نەخۆشیش ناکۆم ئەگەر جگەرە واز لێ بێنە مەمرم. So کەواتە ئەمەیە ستێجی دوای ئەمە contemplation. Now people are aware that you have a problem and try to change, while in this stage still you have not decided to do it, to take action. کەواتە لە contemplation you are aware but still you have not decided to change your behavior. اینەکە لێرە کەواتە یەکەم جار ئەوێر نەبووی ئێستا ئەوێری بەڵام دیسایدە نەیەوە. So now you will go to the third stage, preparation. Prepare yourself to change. So in this stage, you have intention to change, but in this stage, you may not do it successfully. So you try to modify some of your behavior, but not reach the exact to your goal. So, for example, smoking fewer cigarettes than usual, but have not yet made the commitment to eliminate the behavior altogether. کاتە خۆت ئامادە کردووەت هێواش ژگەرەکە کەمەکەیتەوە بەڵام بە تەواتی ترکرد نەکردووە. کاتە تۆ ئینتێنشنت هەیە لێرە و دەست کردووە بە ئاکشنەکە بەڵام بە تەواتی تەواو نەبووی لە پریپێریشنە. ستێجی چوارەم ستێجی ئاکشنە. So occur when people modify their behavior to overcome the problem. Try to overcome and to succeed and to eliminate every obstacle in your way to leave the behavior. So action requires the commitment of time and energy to making real behavior to change. So most of the action need what? Need time and energy. You should have a time and energy to do that action. So it includes stopping the behavior and modifying one's lifestyle and environment to read one's life of cue associated with the behavior. تو لم لێرە چی ئەەکەی؟ ئەو شتانە دوورەخیتەوە لە خۆت ئەو ئینڤایرۆمنتە دوورەخیتەوە لە خۆت کە کاریگەری هەیە لەوەی کە تۆ بەردەوام بیت جگەرە کێشانە. بۆ نمونە ناچیتە کافتریایە کە بەردەوام ئەو هاوڕێنت لێ بە جگەرای کێشێ، ناچیتە کۆبوونەوەیەکە کە بەردەوام جگەرەی کێشی لێبێ. ئەزانی بە چ شتێک مۆتیڤە بی کە جگەرە کێشی هەوڵی لەو مۆتیڤە دوورکەویتەوە. بۆ نمونە لە سۆشیال میدیا دوورەکەویتەوە کە هەواڵی ناخۆشی تایە. کەواتە لێرە ئاکشنەکەی ئینڤایرۆمنتەکە دروستەکەی کە تۆ واز لە بیهیڤیەرەکە بێنی. کەواتە لێرە تەواو گەیشتیتە ستێجی ئاکشن کە ستۆپی سمۆکینەکەی و هەوڵی توش نەبیتەوە. The last stage maintenance کە لە هەموو شتێک گرنگترە. زۆربەی کەس دیومانەوازی لە جگەرە هێناوە بەڵام دوای چەند ساڵە دەستی پێکردێتەوە. کەواتە گرنگترشیە maintenance. In the stage of maintenance, people work to prevent relapse. Relapse يعني سەرهەڵدانەوە. And to consolidate پتەویکە چی؟ The gain they have made. ئەو سوودەی کە پێو گەیشتووە ئەتەوێت چی بکەیت؟ consolidate تیکەی. کەواتە in the maintenance stage چی importantە؟ prevent relapse and to consolidate the gain that we have made. So, for example, if we can to remain free of an addiction behavior for more than 6 months, so it is called that we are in maintenance stage. So, for a person to stay in a maintenance stage should be away from that bad behavior more than 6 months. 6 months. So you need more than 6 months to say to yourself that you are in maintenance stage. Kawata, بخيرای بلینەوە pre-contemplation. You have no intention and you are not aware about your problem. While in contemplation, you are aware about your problem but not decided yet. In preparation, the action will start but not done successfully and not completed. The action not completed 100%. Try to decrease, for example, and the number you smoke per day. While in action, the action is completed. and maintenance, try to maintain and to prevent relapse and to consolidate the gain that we have made it. Now, the last topic is cognitive behavioral therapy and cognitive behavioral approach. What does that mean? Cognition يعني تيجيشتن إدراك فهم. So behavior also كوتا كواتلم ثيرابيا شي هردوش تكا بكاريا هم our cognition and our behavior. So it is called cognitive behavior therapy. So try to change the cognition of a person. So this is CBT, the job of the psychiatrist, psychologist, the psychologist. Try to change the behavior through the change in cognition of the people and through the change in behavior of the people. So there are some approach about the change in behavior. First, cognitive behavioral therapy, which is very important step in managing more of the psychological illness. So, as we mentioned, based on the principle that modify both thought, cognition and thought, it is the same, and action, our behavior. So, أقول true false abotan beto kawata componenti CBT chia, cognition or thought, and action, behavior. So, if you change these two, we can improve our psychological and physiological problems. So, first one is self-monitoring, through the self-monitoring. So, the individual try to track their emotion, their behavior, and try to be aware about your problem and which thing has effect on your health. So this is through yourself, self-monitoring. So you are talking about yourself. Is this behavior has effect on my health or not? So the second one, stimulus control and behavior modification. This involves modifying the environment to reduce trigger for unhealthy behavior. Like what? Removing junk food from the home. تو ئەکەرتوێ کێشە دابەزێنی ئەبێ لە سەلاجەکەتا جەنک فودی تیا نەمێنێ. جەنک فود هەموو دانەزانن بسکیت و نەستەلە و کێک و شیرینی و ئەوانە بۆیە لە کاتێکە کە بێتاقەت بووی یەکسەر زۆر هەندێک کەس بە بێتاقەتی شتیایەکرێتەوە زۆر جار کۆرتیزۆڵ ریلیز دەبێ وا لێکە increase your appetite. So دەگای سەلاجەکەیەکەیتەوە گە شیرینی تیا بێ یەکسەری خۆی. So کەواتە بێت چی بکەی ستیمولەسەکان لابی control stimulus-ەکان بکەی. دانێکیان چیە self-control technique. You will learn some strategy to manage your urge, emotion, or thought that interfere with the healthy behavior. So try to avoid those urge you to do something. بۆ نمونە ئەڵێ هەموو جارێکە من سەیری ئەم فلیمە بکەم ئێرجێکم بۆیە کە بچم جگەرە بکێشم کە بچم بخۆمەوە کە بچم شیرینی بخۆم کەواتە استراتیژیەکان تەگۆڕی کە کەم لەوانەیە سەیری موڤی بکەی باشە ئەوانی کە ئەو شتانی ئیفێکتیان لەسەر ئیمۆشنت هەیە هەوڵەیی لی دووربی کەواتە استراتیژیە بۆ خۆت دائنێ کە نەچیتە ئەو شوێنانەی کاریگریان لەسەر ئیمۆشنی تۆ هەیە لەسەر بیری تۆ هەیە شۆ بۆیە کە چی ئینتەرفیر نەکەن ئینتەرفرەنس نەکەن لەگەڵ چییە لەگەڵ هێڵتی بیهیڤەرەکەتان تۆ کاڵەیە کە چمە کافتریا کەواتە من نێرگە لای کێشم کەواتە you put a strategy not to go to the cafe So the fourth one, through behavioral intervention. These include classical and operant conditions where positive behavior are imposed through reward and undesirable one are discouraged. كواتا أمان لري reward sometime بونمونا دور بركة دقر لتوام ترقي زوجة دايقو باو توتي قرم جقر ترقي ياشتي ترقي إما پاداش تكتكي يتر سفرك بيكن سعره بۆ کڕن یا شتێکت بۆکەن یا خۆت لە بیر و بۆچوونی خۆتە ئەڵێ کە من healthy behaviorم هەبێ نەخۆش if you have a if you have a healthy behavior, I will not get the disease, and you reward yourself. The fifth stage through the modeling. So modeling, individuals are encouraged to observe and imitate a healthy behavior from role model. So you will put a role model for you, an actor, which is very healthy, a soccer people, anything, your father, your mother. So you put a role model for you to imitate their healthy behavior. And the sixth one, social skill and relaxation training. So these are crucial for stress management and preventing relapse into unhealthy habit. So you'll do some relaxation training, like yoga training, some exercise. You will communicate with the healthy people. You will have the meeting about the health with some expert personnel. And the last one, through the interview. So this technique helps individuals explore the reason for change and resolve ambivalence. So sometimes this interview, you will have interview with the psychiatrist, with the psychologist, with the doctor, to change your behavior. So another things is through the cognitive restructuring. A person try to identify and challenge a negative thought pattern. So, for example, if you say, I'll never succeed, so you'll not be succeeded. So you should restructure your brain toward a positive direction, not a negative direction. So you replace the negative thought by a positive thought. Eliminate every negative emotion in your brain. And the last one, through the relapse prevention. So this is through a program which focus on identifying high-risk situation and building coping strategy to prevent regression to the old behavior. So the last stage is to type of treatment is prevention of the relapse. So you always follow a community, people who are healthy and not going to a place which make your behavior, bad behavior relapse again. So in conclusion of our lecture, so the conclusion of the lecture on health behavior emphasize what important of understanding and modifying health behavior for what? To promote overall well-being. And the lecture also try to talk about the significance of adopting the healthy habit in early life. because it has a great effect in the future. So, and the challenge associated with the changing established behavior. And we highlighted the role of various psychological model and intervention to achieve health promotion and to preventing the disease and to get a goal to prevent the disease. And we discussed the benefit of successful behavior modification, such as reducing death due to lifestyle-related disease, increasing life expectancy, and improving of the quality of life free from chronic disease and complication. Thank you. Do you have any question?
دەست خۆش دکتۆر گیان.
سەر خۆش بێ. ئێمە هەوڵەین هەر ژینەکە ئەوانی کە غیابیان نەخوێنەوە کە ئەوە کێشتانە بوو دوێنێ.
دکتۆر دوێنێ خیاب ینی خوێندرایە بە زووتی لەگەڵ فاکڵتیا قساکەم پرژەوتی لەگەڵ فاکڵتیا قساکەم زانم خیابتان وەرگرم یان نە.
زۆر باشە ئێمە چکێنەوێ باش سبار چینە سەر ئەتێندەنسەکەی ئەمڕۆمە 8.
دکتۆر گیان لە نوێم حەزڕگە نەختێتە بە لیڤیان کە دیارە خەتیان بڕابوو بوونێ کارەباوە.
خوای نازانم وەڵا ئەمە مشکلێت لەوێ
دووسێتە لەوێ ڕۆشتن.
وڵای تر باشە وەڵحاصڵ بەزەی خوێنمەوە لێرە تیکی ناکەم چی بکەم نازانم چکە تیکی شیرەکە یعنی حەزڕەکەم نەوتۆتەوەی کێشێ هەرچەندەوە زەم جەماعەتی کوالیتی شوران ساتە ناو محاضرەکەەوە وانێ